school is hard enough as it is growing up as a child these days, without the added complications of childhood obesity. This epidemic increases risk of heart disease and diabetes, as well as causing psychological issues like heightened anxiety and depression and lower self-esteem. Now imagine adding these issues to the already existing problems of growing up. In fact, 1 in 5 children are obese, and this was said by the CDC. This is a startling statistic and explains why heart disease is the champion lead cause of death in the US. When considering that 1 in 4 adult deaths are due to heart disease, prevention at early stages is increasingly more of an important idea. This is why the prevention of childhood obesity as early as possible is vital, because there are so many proven links between childhood obesity and later problems with health in your adult life. The key points that I will be making include that childhood obesity affects far too many, and our most powerful tool in fighting that problem is early prevention. I believe childhood obesity is a structural problem. Our schools and institutions are not providing enough educations about ways to improve our children's habits and life choices. First, I will cover the overwhelming fact that the prevalence of childhood obesity has only been increasing. Childhood obesity is a very difficult problem to face because there are so many things that factor into the causes and solutions. There are so many factors that are cultural, environmental, systemic, and political that factor into this problem. And this was said by Erica Kenny, a researcher at Harvard School of Public Health, for Huffington Post on September 13th, 2019. And this all goes without mentioning the price tag on healthcare that obesity causes our nation. As said in a press release for the University of Carolina on January 17th, 2019, the price tag of obesity-related medical care weighs in at $147 to $210 billion annually. In order to understand childhood obesity and prevent it, it is vitally important to understand the causes. The causes of obesity belong to areas of socioeconomics, psychology, genetics, and family and societal effects. Approximately 70% of an individual's risk of obesity is driven by genetic factors. And this was said by Ted Kyle, an Obesity Action Coalition news release writer, on November 15th, 2019. But the most common cause is a high-calorie, low-nutrient diet and a sedentary lifestyle. And this was said in a news release by Pennsylvania State University on March 7, 2019. Lastly, it is hugely important that we focus on all areas and factors of obesity in order to find personal and institutional solutions to the problem. This is essential because starting with the government could be the most impactful. We need to consider an evidence-based behavioral and psychological approach so policies and initiatives can be designed to make more meaningful change. And this was said by the British Psychological Society on November 3rd, 2020. For families, we can make an impact by making sure healthier choices are available for our children or family members. Limiting access to unhealthy foods and using encouraging enforcement when the children make healthy choices is a sure way of helping to prevent child obesity. And this was said in a news release by the University of Kentucky on February 14, 2018. As individuals, we can make an impact by making sure that we are petitioning our schools and legislations to expand physical education programs, remove the availability of unhealthy foods and drinks, and similarly, we can donate resources to programs fighting child obesity and ask City Council to make public parks accessible to all families and kids. And this was said by Robert Wood Johnson Foundation on February 5th of 2015. In conclusion, all these factors and reasons are why finding a solution to childhood obesity is so important, and why preventing obesity early in life is vital to helping in our fight against heart disease. One of the most important statements to remember is by the World Health Organization, which was released on April 1st, 2020, and that is that obesity is preventable. And if we remember that, we will be far in helping our community make more of an impact on childhood prevention of obesity. Thank you.